5 early signs of weak bones you should never ignore. Imagine waking up one morning and bending slightly to tie your shoes. Suddenly, a sharp pain shoots through your back, leaving you frozen in place. Or perhaps you have noticed that you seem to have lost some height, or that your posture has changed over time. These are not simply harmless signs of aging. They could be warning signals that your bones are becoming weak and fragile. Weak bones do not happen overnight. They deteriorate silently, often without obvious symptoms, until a fracture occurs. In this video, we will uncover 5 early signs of weak bones that you should never ignore. Each one is supported by scientific research and medical evidence. Watch carefully until the end so that you can protect yourself and your loved ones from preventable pain and disability. 1. Receding gums and dental problems. Most people rarely think about their teeth when they think about bone health. Yet your jawbone is a vital part of your skeletal system. Early signs of bone loss can often appear in the mouth before showing anywhere else in the body. According to medical experts, receding gums can be one of the earliest indicators of declining bone density in the jaw. When the bone beneath your gums weakens, it cannot support your teeth properly, causing the gums to pull back and exposing more of the tooth root. If you have noticed that your gums are receding faster than expected, that your teeth feel loose, or that you experience gum disease more frequently, do not ignore these symptoms. They may indicate that your jawbone and, by extension, your overall skeletal system are losing strength. The appropriate response is to consult your dentist and ask whether imaging or a bone density screening of the jaw is necessary. At home, ensure that your diet is rich in calcium and vitamin D, which are essential nutrients for bone health. 2. Weaker grip strength and difficulty with daily tasks. Have you recently found it harder to open a jar, carry a grocery bag, or twist a doorknob? A decline in hand strength might seem insignificant, but it is actually a powerful predictor of bone health. Scientific studies show a strong connection between low hand grip strength and reduced bone mineral density. In fact, many doctors now use grip strength tests as an indirect measure of skeletal robustness. When bones begin to weaken, the surrounding muscles also lose tone and endurance. If your hands tire easily, if you drop objects more often than before, or if even simple chores seem physically draining, it may be time to investigate further. You can start monitoring your grip strength with a hand dynamometer or by noting how your ability to perform routine tasks changes over time. Engage in resistance exercises that strengthen both muscles and bones, such as lightweight training or squeezing therapy balls. Also, include adequate protein, magnesium, and zinc in your diet to maintain the natural bond between muscles and bones. 3. Brittle fingernails and abnormal nail growth. Your fingernails are made from keratin, but their condition can reflect what is happening deeper in your body. Brittle or ridged nails are often overlooked indicators of mineral deficiency and bone weakness. When the body lacks essential nutrients such as calcium, collagen, and magnesium, nails may become dry, fragile, or slow to grow. If your nails crack easily, have vertical ridges, or take much longer than usual to regrow, you should pay attention. Do not treat these issues only with external nail products. Instead, examine your nutrition and make sure you are consuming enough foods that support bone and nail formation. Dairy products, green leafy vegetables, nuts, and fish rich in omega-3 fatty acids can all help strengthen both bones and nails. A blood test can also determine whether you are deficient in vitamin D, which plays a major role in calcium absorption. 4. Loss of height, spinal compression, and stooped posture. Perhaps the most visible sign of weak bones is a reduction in height or a developing stoop. Over time, the small bones in your spine, known as vertebrae, may become porous and fragile. When this happens, they compress under the weight of the body, leading to a gradual decrease in height. This is known as a compression fracture. If your posture has become more bent forward, or if you seem to be shrinking, it is not merely an illusion. Medical institutions such as the Mayo Clinic and the National Institute of Arthritis and Musculoskeletal and Skin Diseases identify this change as one of the most definitive signs of osteoporosis. You can monitor your height once a year and compare the measurement with older records or photographs. Even a small loss of a few centimeters should not be ignored. If you notice these signs, seek medical advice and consider imaging tests of your spine. You can also improve your posture through back and core strengthening exercises such as gentle yoga or Pilates. Avoid prolonged sitting and maintain a diet rich in calcium and vitamin K2, which supports spinal bone integrity. 5. Sudden back pain or unexpected fractures. The fifth sign is often the one that brings people to the doctor, but by then the damage may already be serious. Sudden unexplained back pain is a classic symptom of microfractures in the vertebrae caused by weak bones. These fractures can occur even from ordinary movements such as bending, coughing, or lifting something light. Hospitals and research institutions confirm that such fractures are among the first noticeable outcomes of advanced bone loss. If you experience sharp pain in your mid or lower back without any clear reason, do not dismiss it as simple muscle strain. It could be the result of your spinal bones compressing under pressure. Likewise, if you experience fractures from minor falls or impacts that previously would not have harmed you, you should seek a bone density test immediately. A DXA scan can measure your bone mineral density and reveal whether you have osteoporosis or osteopenia. Early detection allows for timely intervention with medication, nutrition, and physical therapy. Recognizing the pattern. When you consider these 5 signs together, receding gums, weak grip strength, brittle nails, height loss, and sudden back pain, you begin to see a clear pattern. They represent your body's subtle way of alerting you to declining skeletal strength. If you experience 2 or more of these warning signals, especially if you are over the age of 40, or have risk factors such as menopause, family history of osteoporosis, or long-term use of steroids, it is vital to act quickly. Detecting weak bones early can prevent years of pain and preserve your independence and quality of life. 5 protective actions you can take today. There are several simple but powerful actions you can begin immediately to maintain strong bones. 1. Schedule a bone density test, DXA scan, to assess your current condition and identify risk zones. 2. Adopt a bone-supportive diet rich in calcium, vitamin D3, magnesium, vitamin K2, collagen, and high-quality protein. 3. Engage in weight-bearing exercises such as walking, jogging, dancing, or resistance training, which helps stimulate new bone formation. 4. Eliminate habits that damage bone health, including smoking, excessive alcohol use, and unnecessary long-term use of certain medications. 5. Regularly monitor your progress with follow-up scans and periodic adjustments to your exercise and nutrition plan. These steps are simple yet scientifically proven to slow or reverse the progression of bone loss when practiced consistently. Your body has an incredible ability to heal and rebuild itself, but only if you listen to its early warnings. Each of these signs, no matter how small, should be viewed as your body's gentle whisper for attention before it turns into a scream of pain or a life-altering fracture. If you recognized any of these 5 symptoms in yourself or someone close to you, please take action now. Visit your doctor, get a bone scan, and start making small but meaningful changes today. Do not wait for a fall or a fracture to teach you how fragile life can become. Share this video with your family and friends so they can protect themselves too. Click the like button, subscribe to this channel, and enable notifications so that you never miss a new science-based health video. Tell me in the comments which of these signs surprised you the most and what step you are planning to take first.